So this is a huge issue, obviously, and I think with the new regulations coming out, the veterinary feed directive, that's removing all growth promotion claims from any antimicrobial that we use for any food producing animal, and that's probably the right answer. I don't refute that one bit. Uh,
Trent, could you talk a little bit about, so you said it removes the growth promotants from all antimicrobials, but what is the veterinary feed directive is going to come into effect this December, and could you talk just a little bit about that?
So
What it
basically,
is?
what will it will entail is right now there's feed additives that can be given by a producer to their animals without any veterinary oversight or prescription, if you will. And basically, what this veterinary feed directive will do is it will require that. So before a feed mill can distribute a particular drug or a feed containing a drug, they'll have to have an authorization from a veterinarian to get that particular product. So a little more paperwork on my end, but probably ultimately what it's going to do is provide more veterinary oversight to more animals that are out there. Because when you, like Bob talked about, the little 5 and 10 and 20 head cow-calf producers, some of them may never work with a veterinarian. And now, if they want to use these products, they're going to be forced to. So from that standpoint, I think it's great for the industry. I go back to the growth promotion claim, and the reason that I get hung up on that a little bit is because that is just one metric that we look at for animal welfare. So if we're reducing a disease process in an animal, they're going to perform better. So even though the overarching metric is they're performing better, it doesn't mean that it has nothing to do with reducing disease. So just so that is out on the table. But so I think that is probably part of this balance, right? More veterinary oversight of more animals to reduce antimicrobial use. There's no doubt that it has been abused in the past on both, in all facets of medicine, animal, human, and across the board. And so I think that the whole One Health concept certainly plays into here. And we as veterinarians need to do our part, and as cattle producers as well, do our part to reduce that use. I think when you take out some of the uses where the product is added into the feed, that is where the large numbers of usage comes from. So as we reduce those numbers that we're utilizing the feed, the overall use of antimicrobials will decrease. If we look at how much is used when I treat an individual, that amount of antibiotic is very, very small compared to when you're treating at the herd level. So I'll fight for our ability to treat an animal that's sick, because to me that is a welfare thing, and that's what we as veterinarians do. Now we need to make sure that we're treating the right disease at the right time with the right product to be effective. We don't need to blindly go at this with like a shotgun approach, if you will. So, and that gets back to my little spiel earlier about empowering people, teaching them this is what an animal with a foot rot or a lameness issue has. This is what an animal that has pneumonia looks like. This is what an animal that has diphtheria looks like, right? So that's part of a veterinarian's role, is to help to make sure we're identifying the proper diseases so we can get the proper treatment and the overall best welfare outcome for that animal. So,
from a cow-calf perspective, as far as antimicrobial use, as kind of I mentioned earlier, as far as some of the biggest disease concerns, there's two kind of areas that I am concerned about with cow-calf production. One is just endemic diseases and by endemic disease, what I mean is they are stable within the population. They're probably constantly present at some level. It's kind of co-evolved with the cattle, in that it's very difficult to imagine getting rid of those diseases. and yet they typically don't cause big problems unless they do. And many of these have an insect vector. One of the ones that is going to be a challenge to deal with without antibiotics would be anaplasmosis, which is a tick-borne rickettsial disease. So humans are aware of rickettsial diseases like Rocky Mountain spotted fever and things like that. So it's a tick-borne disease. Our ability to control ticks themselves is limited. Humans know that. It's difficult to deal with ticks. And so we're left with not only trying to attack the tick, but try to attack the rickettsial organism that they're passing. And really, antimicrobials is our only tool. So that in areas where this endemic stability between the insect and the animal, to go to an antibiotic-free situation would be to accept quite a bit of endemic disease at a level that causes quite a bit of welfare issues, death, and problems. So I think it's very important as veterinarians and cattle producers that we are active participants in the debate about antimicrobial use, because I don't want to be the point where it's all or none. In other words, we as veterinarians and producers have to take the responsibility to use antimicrobials very judiciously, only when they're going to give us the biggest bang for the response, the biggest response for treatment, and to make sure that we have them in those diseases where we really don't have any other tools. There are other diseases where antimicrobial is only one of several tools that we use, and that's when they kind of need to be used as a last resort. In diseases where we don't have other tools, I really want them available, and so that's going to take good communication.